Today we're welcoming Good Shepherd, so Becca McAtee and her folks over there at Good Shepherd. They're going to be presenting about what their new facility is going to look like. As you know, these presentations are our way of sharing our knowledge and partnerships with other nonprofit organizations in the Lehigh Valley. And so this is a great thing for us to be able to share with our partners and fund holders. You're welcome to put questions in the chat box as we're going through the presentation. And there'll also be some time at the end. So any additional questions, we'll make some space there for that. So I want to turn this over now to Becca, and she can introduce the presentation and go from there. So thank you, Becca.
Thanks, Carrie. Again, I'm Becca McAtee with Good Shepherd. I'm the capital campaign manager for our exciting new hospital project, but I am really excited that we have Michael Spigel here today, our CEO, and he's actually going to be able to walk through our presentation for you and our vision for the future of Good Shepherd. So I'm just going to be running some slides, which I will pop up for us, and then Michael can kick it off.
Great, thanks, Becca. Can you hear me okay?
Yep.
Yep.
Okay, good. Well, I just want to start by, thanking everybody for the invitation to speak today. I really appreciate the opportunity and time to talk about what's going on at Good Shepherd globally, and then most importantly, what's going on with the new hospital that, about 5 weeks ago, we began construction over in Center Valley. And so I'm looking forward to being able to talk to you about both of those topics. So thank you. I just want to begin. I've lived now in the Lehigh Valley area, Allentown specifically, for a little over a year and a half. My wife and I moved up here. We'd been living in Jacksonville, Florida. I had grown up in Baltimore, though, but we've been working in Jacksonville, Florida. And we moved up in July of 2020. I used to say it was in the middle of COVID, but it was really probably the first third of COVID. And we jumped right into really being an Allentown. Just real quick, are you guys able to hear me okay?
Yes.
Yes.
Okay, I'm getting a weird message that says join the audio. So, we got here in July of 2020 and jumped right into kind of the Allentown world. We initially lived in an apartment down in City Center while we were looking for a house, and we bought a house in the west end of Allentown, right around 28th Street. We can look from our windows over to the Rose Garden. And, I was thinking about it before our meeting. My wife and I have lived in 7 states since we've been together. And we often say this is the best house we've ever lived in and the best neighborhood that we've ever lived in. So we've kind of jumped right into learning Allentown, learning Lehigh Valley, learning everything around here. And it's just fantastic. We do have a daughter, but she just graduated college and is living up in Boston, but has also been able to spend quite a bit of time with us in our holiday breaks down here in Allentown. So like I said, I'm excited to talk about what's going on at Good Shepherd, and particularly about our new hospital, which is really, probably maybe the second or third most transformational event in the 113-year history of Good Shepherd. I think about it, that transformational event number one would have been the founding of Good Shepherd many years ago as an orphanage for children. And then transformation number two would be when Good Shepherd actually built their first inpatient rehabilitation hospitals, which was amongst the very first rehabilitation hospitals ever developed in the country. Good Shepherd developed inpatient rehab soon after the Medicare program recognized inpatient rehabilitation hospitals as a distinct facility. So Good Shepherd was amongst the very initial few. And so maybe that was transformation number two. And then transformation number three is the development of a state-of-the-art campus that will open in June of 2023. So Becca, with that, can we go to the next slide?
Oops, skipped ahead.
So I would just want on this slide, I think we missed one.
Yeah, there you go. Sorry.
Yeah, I want to talk a little bit about who Good Shepherd is. You know, I think everybody on the call has a context for Good Shepherd, and in another minute or two, I'm going to talk about, you know, the unique and the distinct services that we offer here. But one of the things that I find and have found in the time that I've been here is a lot of people don't understand the scope and the size of Good Shepherd, and particularly our joint venture relationship with Penn Medicine in Philadelphia. So at Good Shepherd, we have about 2,300 employees. We have a very large partnership with Penn Medicine. We have nearly 1,000 employees in the Philadelphia area through our joint venture, where we provide, you know, many of the same things we do up here in Lehigh Valley, we do as part of our joint venture with Penn Medicine. And so it really, you know, adds another unique dimension to who we are, to have that partnership with a health system that has the reputation and the cachet of a Penn, and the fact that we have 1,000 Good Shepherd employees in Philadelphia in Penn Medicine as part of our organization. You know, we are obviously a very proudly not-for-profit provider. We specialize in what is referred to as post-acute care and rehabilitation services, which I'll talk about in a minute. And we have particular competencies in helping and working with people following a stroke, a brain injury, spinal cord injury, major musculoskeletal orthopedic illnesses or injuries, pediatric rehabilitation, pulmonary disease, and many other often very, very complex injuries or illnesses that people face. And then one of the unique features of Good Shepherd, and this probably goes back to its long history of being an explorer and trying new things, is Good Shepherd has always been an early adopter of trying new technologies that help people with paralysis or other major injuries or illnesses. And I bring it up because that's ultimately going to be a very key feature in what we do with the new rehabilitation hospital. So Becca, can you go to the next slide? So as I mentioned, we have between 22 and 2,300 employees. Between both up here in Lehigh Valley and down in Penn, we have 65 distinct locations. We provide 5 levels of service. And between up here at Good Shepherd Rehab and in Penn, just our outpatient clinics alone, we have about 500,000 patient visits a year. And we have over 2,500 inpatient admissions to inpatient rehabilitation, pediatric inpatient rehabilitation, long-term acute care. And then we are highly accredited by CARF, which is the Commission for the Accreditation of Rehab Facilities. It's pretty common that most rehab hospitals have one CARF accreditation. It's highly unusual that an organization has 6 distinct accreditations for things like spinal cord injury or pediatric or stroke or system of care. So it's highly unusual to have 6 accreditations, which up here in Lehigh Valley, we've been recognized and awarded by through CARF Association. And as I mentioned, we were founded in 1908, so a good long 113-year history right here in Allentown. So Becca, can we go to the next slide? So if there's one thing that I've learned in my time here when I talk to people, is people have different views of what we do at Good Shepherd. And it usually is based on their historical interaction or knowledge, or more likely a family member or a friend who may have used one or more services of Good Shepherd. But we actually are engaged in a whole variety of services. Inpatient rehabilitation, a hospital. So this is the hospital we have in South Allentown that we'll be building the new hospital in Center Valley. An inpatient rehab hospital, we see patients who have had a major injury or illness, like a stroke, like a brain injury, like a spinal cord injury, major trauma. These are people who usually have had a relatively long stay in trauma or acute care, and then require both continued hospital care, but really the focus turns into providing a very significant amount of rehabilitation, 3 to 5 hours a day of rehabilitation services to help somebody recover from or compensate for, what often are permanent and often substantial disabilities. And so the inpatient rehab hospital is a critical part of what we do here and a critical part of systems like Good Shepherd. We have outpatient rehab clinics where we see people on an outpatient basis. Maybe they have knee pain, back pain, which is pretty common. Maybe they've had a joint replacement. Maybe they were someone who had a stroke who has left the rehab hospital and now is going on to outpatient as their next level of care. And up here in Lehigh Valley, we see about 220,000 patient visits in our outpatient clinics annually. We also have 2 long-term care facilities, our Raker home and our Bethlehem home. And so these are long-term care facilities, and we are extraordinarily unique in what we do in long-term care. So we are one of 3 facilities, or 2, I'm sorry, of 3 facilities in the state that we focus on adults with disabilities that require a long-term care accommodation. So, long-term care, you can think of the phrase nursing home, skilled nursing facility. Unlike most long-term care that really focus on frail elderly at end of life often, the average age of our resident is about 41 years old. We have many people who move in when they're teenagers, 18, 20s, and 30s, and will be with us for decades. And they have some very, very substantial disability. It could be catastrophic brain injury, spinal cord injury, MS, cerebral palsy. But the unique thing is all of our residents are younger, and many of our residents are with us for decades. Long-term care is really part of the very, very most core mission of Good Shepherd is both the Raker home and the Bethlehem home. We also have Good Shepherd at Home, which is providing in-home healthcare services, nursing and therapy. Most of our patients that we see have left an acute care hospital or our rehab hospital or one of our other settings. We also have a unit, a 28-bed unit in the Lehigh Valley Muhlenberg Hospital of what is called a long-term acute care hospital. So this is not highly utilized, meaning as a service nationally. It is for people who are very, very ill, typically on a ventilator for a long period of time, no longer need to be in the acute care ICU, but move to a long-term acute care hospital. We have the only one in Lehigh Valley. We also operate one in Penn Medicine, and most of our patients come to us on ventilators, are with us for an extended period of time, and we have a special competency in helping people get off the ventilator and move to the next level of care, which is often inpatient rehab. We have our medical group of physical medicine and rehabilitation physicians. These are doctors who specialize in rehabilitation medicine. We have a very large pediatric rehab program, both on the outpatient side, but a very unique inpatient rehab, pediatric rehab hospital, which is located in Bethlehem. We see some of the most severely involved children I have ever seen in rehab. We see many young kids who premature, on ventilators, failure to thrive, and they come to us, and we really do an amazing thing with helping the kids and families get back home. Virtually every one of our kids who come to our inpatient rehab ends up back home, which is our goal. And then wrapping around all what we do, we have a whole host of various community-based services, whether it's support groups, whether it's exercise programs for people with Parkinson's or MS or dementia, a whole range of community-based services. So in total, up here in Lehigh Valley, there's about 1,300 of us who are involved in all these services for all the many, many people that we're really privileged to serve every year. Becca, can we move on? So, we put this slide up. I always kind of hesitate saying we're the #1 ranked for rehab in Lehigh Valley because I like to talk about our role in Lehigh Valley. We work very, very, very closely with St. Luke's and Lehigh Valley. Many of our patients come from them to us, and so we share patients both with Lehigh Valley and St. Luke's, and we're excellent partners together. We elevate all that we do, and we provide the solution for many patients that Good Shepherd is really the best solution for them in Lehigh Valley. So I always talk about it that we share patients with our local acute care systems. We have a very important role to play in our patients' lives as they transition back to their physician services that they may have through St. Luke's or Lehigh Valley. So it's an important role that we play, and we partner very closely. And as I mentioned, we share patients between our 3 systems. Becca, can we go to the next slide? So now I'm going to transition to what we're doing. So we have been in the South Allentown campus, our inpatient rehab hospital. We've been in it since the early 80s. Obviously after that many years, it's a rather old building. And so we will be building a brand new rehab hospital. And this is the location. So we are looking at the right over the promenade shops to the right. And you can see where this red circle is down to the lower right. That will be the location for our new rehabilitation hospital. We have about 45 acres of land here. And you can see kind of the land split down the middle with that gray walkway. All the land to the right is developable property. All the land behind it would always remain a green space. It's over zinc mines. Really can't build atop of it, which is fantastic because we're always going to have this gorgeous green outdoor area that you'll see in a few slides how it merges with what we're doing at the hospital. So we will be using about 10 or 11 acres of the 45 acres. Again, only about 20 to 25 acres are developable. Our project will take about 10 of 11 acres. We are directly across the street from the movie theater at the promenade shops and in a fantastic location to be really conveniently located for people in Allentown, Lehigh Valley, or people who come from a distance to take advantage of the services that we have in our new rehab hospital. Becca, we can go to the next slide. So this is just a bit of a transition slide. On the left is our current facility, and on the right is a bit of a rendering of our new facility. So I put this slide up here because I want to talk about what will happen once we relocate off of the South Allentown campus. So currently in South Allentown, we have a number of services. We have our rehab hospital. We have the Raker Home, which is long-term care. We have the Highland Center, which is a very large, busy outpatient rehab and physician center. We have about 100,000 visits that go through that center in a year. We have all of our administrative offices and our support services are located down here in South Allentown. And so what I tell people is the only part of our South Allentown campus that is moving is the rehab hospital. Everything else I mentioned will stay down here, from our administrative offices, support services, outpatient, Raker Home, assisted living, the Supple campus, which is right on our campus, and the inpatient rehab hospital is what will be relocating. We have every intention of reusing the hospital. We've kicked off a planning process of how we may reuse the hospital building, which services might be amenable to go into the building after we do a renovation of the building. It is a very old building. So our intention is to ultimately reuse this building, keep it on our campus. We have a beautiful campus in South Allentown, and really ultimately over the long term, add to what we do, build a new campus, and then renovate and provide new services down here in South Allentown. Becky, can we move to the next slide? So there's a lot of advantages that our new hospital will have. I really think the most important one is the left. We will be the only freestanding rehab hospital 100% dedicated to inpatient rehab. It's all we think about. It's all we do there. And so, we'll be fortunate in, really our community to have something as unique and as profound, and which the kind of cachet and the gestalt that we'll be building into the rehab hospital. Obviously, we'll have about 225 employees who will relocate to the new campus. That I think will be a real advantage for the promenade shops. And then the rehab hospital we're building, we're actually going to be adding beds. So over time, we'll be adding additional jobs to our workforce in the new campus. And then when we determine and renovate and create our reuse project for the South Allentown campus, an entirely new workforce will be created down here in South Allentown. On the hands-on education, we've had conversations with, really most of the local colleges and universities, and everybody's incredibly excited to be able to play a role in what we're doing, provide student experience, faculty experiences, and I'll talk about some of them in a bit. So with that, Becca, can we go to the next slide? So, we, as I mentioned, are going to be the only freestanding rehab hospital in the community. And I put this slide up here because we were one of the first in the nation to really begin to use robotic technology for our patients who have spinal cord injuries. And that thinking about how Good Shepherd has really been a leader in the use of technology created something very unique we're going to be building into the new rehab hospital, which I believe, and from what I know, there is no other rehab hospital that has created something that we're calling today the Experience Center. And with that, Becca, can we move to the next slide? So this is a rendering of the new campus. We will have 76 all private rooms in the new campus. We will have 4 floors counting the ground floor. It's about 123,000 square foot project. It's going to be on a beautiful area of land. And, you know, if you think about to the left of the picture, it's going to be all green, open space with, you know, a view of the hills. So really a gorgeous building in a very campus-like gorgeous setting. Becca, can we move to the next slide? So as I mentioned, we have a history, a competency, a thirst, and an interest in really using new technology. So when we were designing the hospital, we were asking ourselves, how do we really triple down on the idea of technology, and how do we think about all the changes that are occurring in society around technology? What really, over the long term, is likely to have profound benefit for people living with disabilities? And from that idea, we created what we call the Experience Center. Becca, can you go back one slide? The Experience Center is going to be, if you look to the right of this building, you see the 2-story glass wall, and you see kind of a room opening. That is where we're going to have the Experience Center. So it's going to be in a beautiful setting. And the Experience Center, Becca, we can go on to the next slide. And so what we decided to do in the Experience Center is identify what are emerging trends in technology that we believe have current and profound future applicability to people living with disabilities. And we spent a lot of time studying kind of the mega trends in technology and identified the ones that really we believe are going to help people with disabilities. And so in our Experience Center, we will create, it's actually the first one, is a collaboration between us and Moravian University of a 3D printing center. We'll have the first full-fledged 3D printing center in a rehab hospital in the country as a freestanding rehab hospital. And the best way to think about what 3D printing does is imagine you're a clinician and you have a patient that you wish you could design a certain kind of brace or a certain kind of aid that might allow that person with that disability to pick up a cup. And so you can create that 2-dimensional design on a piece of paper, but it's a unique design because your patient's unique. So there's really, if you had to buy something off the shelf, it would likely be suboptimal or would likely require customization. So in a 3D printing center, a clinician can think of their idea, create what we'll call a 2-dimensional drawing of that idea, give it to an engineer who then codes that into a 3D printing system and basically hits print. And in some period of time, the 3D printer has now printed out that custom device for that person to use. Could be a brace, could be a splint, it could be made to help somebody feed themselves, drink water, get dressed, an adaptation for a wheelchair. It really, 3D printing is only limited by imagination, but it allows that customization, and literally within an hour, within 2 hours, you now have this custom printed device specifically for your particular patient. Fascinating technology. 3D printing is being used to create aircraft parts, joint implants. I mean, they're amazing, amazing solutions that are being created by 3D printing. And so we're creating a 3D printing center in collaboration with Moravian University. We're also creating what's called the Automation Center. So the Automation Center is what are the technologies that enable someone with a disability to become more independent in their life. So the way to think about this is we're all familiar with Alexa and Google Voice, and we're all familiar that we can ask Alexa or Google Voice what time it is, what's the weather, play this music, whatever, make this phone call. But really those technologies and many other technologies can really open many, many doors to people with disabilities to become far, far more independent in their home, in work, in life, by really understanding how to maximize and optimize a lot of these enabling technologies. So within the Experience Center, we will be the place, the destination, where people come to say, I am living in a wheelchair, I've heard about Google Voice, Can you teach me everything that can help me do at home, at work, in my car, in my life? And we're going to be the destination center to do that. We call it the Automation Center. It's a bit of a play on word of autonomous driving, and it's really focusing again on enabling or automating technologies for people. And then the third center in the Experience Center will be wearables and artificial intelligence. So a lot of things I could talk about here, but let me give you one example. In a couple months, we're going to be announcing that Good Shepherd is going to be the first organization in the country. We're going to be engaged in a research project that blends AI with wearables. So I'm going to explain this very briefly. Imagine if you had a stroke or a spinal cord injury and you had limited use of your hand and wrist. Imagine if you could put on a sleeve on your forearm, and that sleeve is embedded with microprocessors, and that sleeve is embedded with focal electrical stimulation. And imagine if you had a bottle in front of you and you want to pick up that bottle to bring it to your mouth to drink. And imagine if you could begin to make that movement. You're thinking a thought, I want to pick up this bottle. This microprocessor sense what you're trying to do and then stimulates the right muscles to allow you to pick up that bottle and then drink it on your own. It's one example of a lot of fascinating technology that's coming out that's blending wearables with artificial intelligence to allow somebody who maybe has paresis or paralysis to literally regain function, to wear this sleeve at home all day, to be able to use your hand and wrist, where prior to that, you really had very limited ability to use, let's say, your hand and wrist. So Good Shepherd is going to be, as I mentioned, in a few months, we'll be announcing we're going to be the first in the country to be doing a research trial of a company that's going to be gaining FDA approval. And then we'll be the first in the country to offer this sort of technology and many other technologies through our wearables and AI center. So this is the Experience Center. It's really incredible. It's about 2,000 square feet. And as I mentioned, there is no other rehab hospital in the country that is doing this or has this. And we're proud to be doing it. We think there's many good things that are going to come out over the next years and decades of how technology is going to change the world for people with disabilities. Becca, can we go to the next slide? So this is just kind of a view of, kind of a 3D printing center. I talked a little bit about this. We can move on to the next slide. So I want to kind of segue. I want to segue to outside. So I mentioned the back half of our property is going to be all green space. It's going to be beautiful. And then because of our location, we're going to have a view of the hills and the rolling hills of Lehigh Valley. And so we thought about, when we were designing the hospital, how do we create a very unique outdoor feature that blends the environment around us, but also serves a purpose for our patients, our families, our visitors, and our staff. And so we came up with the concept of a therapy and activity garden. So this is going to be a very large outdoor space. To give you a sense of the size of this, think of something bigger than the infield of a baseball diamond. So from the fence all the way to the beginning of the outfield, from first to third base, think of those dimensions is going to be our outdoor therapy area. It's going to have an area where our therapists will be able to, with our patients, have therapy outside to help people learn how to face all the obstacles you face in the real world, different services, elevations, so forth and so on. We're going to have gardens for different forms of therapy. We're going to have relaxation areas. We're going to have areas that are really respite for mindfulness, for spirituality. And we're going to have areas that really promote kind of gathering and socialization. And with that, Becca, can we go to the next slide? So we got this rendering yesterday. So really, you guys are the first one, other than a few of us here, who have seen this rendering. So this gives you a view of the outdoor therapy area. So you see the hospital, two-story glass wall is our Experience Center. And then this all merges into the outdoor therapy and healing gardens. And you can see all different kind of segments to the area, again, from therapeutic to respite to spirituality to just mindfulness, with really very significant dimensions. I also want to point out throughout the entire property of 45 acres, we're going to have a trail that, can be a walking trail, somebody in a wheelchair, it could be for exercise, or it could just be out, just be something to get out and get some fresh air and kind of wheel around our entire property. And so that'll blend in with this outdoor therapy and activity center. So really, really incredible. We designed this, it was a really unique design. We asked for volunteers from throughout our company, all different parts of our company, from long-term care to outpatient to inpatient to corporate, and we gave them the charge of, if you were to design an outdoor therapy and respite area, what would it look like and what would you want in there? And those 10 to 12 people really created what we're looking at today, and it's a really, really amazing feature between what we're going to do in our 76 rooms, what we're going to do in our therapy gyms, what we're going to create and offer out of our experience center, and how we're going to merge that with the outdoors. Really is going to make this a very, very special campus. Becca, can we go to the next slide? So a little bit about the project. It's a $70 million project for everything from the building to the FF&E to the land improvements, the road improvements. We financed $55 million through a tax-exempt offering, which we performed that in September. It was really great timing from an interest rate standpoint. And then we have a capital campaign to raise $15 million. I also want to point out that, before our issuance of financing, we were rated by S&P and Fitch, and we have an A- rating from both S&P and Fitch, which we thought was fantastic. And we did put this one quote that was in the S&P write-up: the construction of the new hospital, which boasts a higher number of private rooms as well as state-of-the-art technologies, is expected to enhance the network's competitiveness. So this comes, right out of the S&P write-up on our A- rating from S&P prior to the issuance of our financing back in the first week of September. Becca, can we go on there? So I want to end my presentation and then open it to you, but I want to end with a brief story of really what we do at Good Shepherd and the people that we serve. And, I've been in rehab my entire career. I started my career as a physical therapy and have not known any other industry. And so I do say, and the miracles that we truly do create. So I want to tell a brief story. So in October of 2020, I got a call from a mother of her son was in a hospital in Philadelphia, 39 years old. He had been in an acute care hospital for over 12 months. So you just kind of have to begin to wrap your head around being in an acute care hospital for over 12 months means something really, really complicated and severe happened to you. And one of the complications of his illness was a stroke to his spinal cord. So he had very, very little movement below his waist, but that was really the least of his problems, quite frankly. And so the mom called me and said, I've heard about Good Shepherd. He has been turned down from every other rehab hospital that he's been referred to, and he's been turned down from every skilled nursing facility that he's been referred to. And I really want to see, will Good Shepherd give my son a chance? And so, I talked to the mom for a while. We got his medical records, met with our team here, our medical director, and it was really, really apparent to see why every rehab hospital had turned him down, and really apparent to see why every skilled nursing facility chose not to take a chance. And so we as a team talked about it and challenged ourselves and said, if not us, who is going to help this person? Because clearly nobody's going to help this person. And yes, we can all see the reasons why everybody else has turned this young man down, but we're going to see if we can. We're going to see if we can make something special happen. So after 13 months in acute care, he came up here to Good Shepherd. It was a little bit before Thanksgiving. I remember visiting him the first night he was admitted. Had kind of a down, despondent kind of affect, as you would expect being in acute care for 13 months. He went in the hospital before COVID was even a phrase, and was transferred to us when we were in the heart of COVID. I asked him, hey, can you move your legs? He really had virtually no movement of his legs, and got here in November. began a lot of intensive therapy. Like I said, after being kind of on your back for 13 months, there was a lot of things we had to make up for. By February, he was beginning to have movement in his legs, but, his insurance company, who was very, very generous, felt it was time for him to move on. And so, which really would have meant at that time him going to a nursing home. And there was no nursing home in the area that would accept him. And so, we looked at our long-term care facilities, Raker, and we are always full. And we have about a 3-year waiting list for Raker. And so it immediately wasn't an option. We just had not a room. And so we kept him in our hospital. And, we were going to do the right thing by this young man and kept him here. After a little while, a opening did occur at Raker. We moved him over to Raker in March. Receiving therapy, he began to be able to stand and to be able to walk a little bit in parallel bars. And so you think this is about 16, 17 months after he first went into the hospital. So this would have been in March. In May, it was really time to go home. He was ready. His family was ready. He was up and doing a little bit of standing in parallel bars, a little bit of walking in parallel bars with a lot of supervision. But the family and him were ready to go home after about 18, 19 months in inpatient settings. So he went home in May. I remember going to meet his mom and dad. It was a sunny day. It was a perfect day. They were happy. They had gone through so much. I used to talk to his mom really almost weekly. And so he then continued with us, which he is now in outpatient. And so I go over and visit him a couple months ago. He's now walking with canes, almost unlimited distances, and is virtually independent in his home. And this was a young man that every single facility said, we can't accept you. Every single skilled nursing facility said, we can't accept you. We took the challenge. He and we perform miracles. And this is what we do. And this is what we're going to do in our new campus. And this is what we're going to do more of. So with that, I want to end my presentation and field any questions, any comments, whatever may be on your mind.
Hey, Michael, this is Robbie Wack from St. Luke's. I'll ask a question if that's okay. First of all, thank you for the way you described the partnership between the health systems and Good Shepherd, because I completely agree. I hear from our providers all the time the wonderful work that you do for patients in the community, and it sounds like this new project is going to be really exciting and much needed. I don't know whether or not this makes a difference at all with the location. I assume it doesn't, but more out of curiosity. Do you see a payer mix at all occurring given the move from Allentown? I would think not, given the nature of the patients, but I'm just curious.
At a high level, I would say no. I don't think it'll have much of an impact on our payer mix. I think that the patients that we see today are reflections of A, our community, and B, for many of our patients who sustain like spinal cord and brain injury, it tends to be a reflection of that group of people. Having said that, what we, as part of our strategy and what we believe will happen is with this new facility, with the new capabilities we're going to have, we have very few private rooms today. We'll have all private rooms. With the technologies, with the services, we really believe we'll attract more people who maybe are 60 miles away, 90 miles away, 120 miles away. There are a number of rehab hospitals around the country that have the level of performance and the capabilities that there are people, particularly those with spinal cord and brain injury, that will seek out more destination centers. So I think if we're successful there, we will see somewhat of a lift on our payer mix. Those individuals will tend to probably have a much more generous insurer. But I think that would maybe change our payer mix a bit, but otherwise I think will be a reflection of our larger, broader community today.
Michael, I have a question. With the nursing shortage going on, how many new employees are you going to need for this facility? And I've seen, doing the hiring bonuses and so forth. Have they been working? And what's the plan? Yeah,
wow. There is not a more frequent conversation I think any healthcare provider, us included, has other than what's going on with workforce and particularly nursing. So, we're in we're in a very similar situation as other healthcare providers. You know, we have many more vacancies than we have applicants. And everybody, you know, in every hospital, every long-term care center is struggling with the same issue. It's, you know, it's extraordinarily unprecedented. We have taken several actions. But let me start with the beginning of your question. We do recognize that, you know, on one hand, the new hospital, we believe when it's open will be an attractor to people who want to work in a new hospital. But we also recognize we can't wait that long to have all of our various nursing positions filled. So we've done a couple things here. You know, right now we all know that every healthcare system around the country is offering all sorts of incentives and bonuses to sign-on bonuses, et cetera, for nursing staff. It's a really difficult situation. We're doing that. You know, sign-on bonuses. You kind of have to do that. We did do something very unique. I'll share with the group, and I'll share kind of our response from our nursing staff. So one of the common things that you hear when organizations offer large sign-on bonuses for new staff, which is called nursing staff, is your existing staff is wondering, what about us? We've been here 1 year, been here 10 years, been here 20 years. And so what we put in place last month is a retention program. So for our RNs, LPNs, CNAs, and nursing assistants, it's basically a sign-on bonus. It's really a retention bonus disguised as a sign-on bonus. If you commit to stay with us for, let's say, 2 years, at the end of the 2 years, or throughout the 2 years, here are retention bonuses that you'll receive. So we rolled that out in late January. We set an internal goal that 70% of our RNs would opt in and want to stay with us, you know, see what we're trying to do to recognize them, and that 60% of our LPNs and CNAs would opt in. As of last week, we are well over 80% of all of our nursing staff have opted in to our program. Big sigh of relief, because that was data a week ago. They have to the end of this month to opt in. I think we're going to end up 90+%. And so it's really going to help to bring stability to our current nursing workforce while we work through attracting, like St. Luke's is, like Lehigh Valley, Penn, any healthcare system, any healthcare provider, to give us some greater stability to really work through and attract more nursing staff here. Because really the tale, I think everybody would tell, is the turnover is one thing. The real other struggle is the number of people applying for jobs. Any job has really plummeted. And so I think the new hospital will be an attractor, but we've got over a year before, you know, we're going to be moving into that. But there's not a day that goes by that this is not a major topic of conversation is workforce. Every, you know, whether it's St. Luke's, Lehigh Valley, Good Shepherd, every healthcare provider here, we've asked a tremendous amount of all of our staff, but particularly our nurses.
I know
Thank you, Michael. Oh, hey,
I'm sorry,
Becca.
No, I was going to say we have Sandy Bodnick on the line, who I know is our board member. So I just wanted to see if you had anything to add, because you have actually been involved with Good Shepherd much longer than Michael or I have.
I have been involved for many years, several terms on the board, and everybody knows it's a passion of mine. And I actually wear two hats at this meeting. I'm currently chairing the Lehigh Valley Community Foundation, who does so many wonderful things, and I'm so pleased you had this opportunity to work with them. I had nothing to do with it, but I'm very pleased that we put this format together. And secondarily, I just want to add to the excitement of the building at Good Shepherd, and just maybe make a comment on the history of the good work that has been done by Good Shepherd in the community over the many years I've been involved. One thing we talk about at many meetings and community events is whenever you identify yourself in a group of people, regardless of what kind of group of people they are, you suddenly get 2 or 3 stories about, I had an uncle who, I had a cousin who, I had a relative to, and you get a story of an amazing outcome that has touched somebody's heart and changed a whole family's lives. And I think that's the core of the culture of Good Shepherd. that stands out among the employee base. And I think it's very, very critical for the future. And I think you can see the thought that's gone into this new building to keep that culture and expand on that culture to make it an environment for people to get well in many ways.
Yep. Well said.
Yeah, thank you, Sandy. My question, Michael and Becca, is, we deal with fund holders and individuals that have capabilities of all different sizes. And oftentimes from donors, we often hear on, a big campaign like this is, where there's large dollars involved, how can I make a difference with a smaller donation? And so given all of your needs and where you're at right now, can you comment on where the places for private philanthropy that perhaps isn't, getting a name on a patient room or something? So if you can expand on that.
Becca, do you want to take the first?
Sure. Well, I will say I dropped right in the chat for you our website, our campaign website, so you can look a little bit more on some details after this meeting about the new hospital and the campaign that we have to do with that. We are striving to raise $15 million with our capital campaign. We are about $5.7 million now, and we've really moved into a much more public phase. So just like with every effort, every dollar that we raise counts in this effort. And it does make a difference because it's a lot of money to raise. And we are so glad that we have such a philanthropic community. And this group in particular knows how philanthropic the Lehigh Valley is, much more so than many other places in the country. And I know that this community makes things happen for the people that need it. And I'm really grateful for that.
Yeah, and then I would kind of, merge, kind of like Sandy's comments and Becca's comments, with the history that Good Shepherd's had in this area, there are so many people that have had an experience or a family member experience. I mean, I'm always blown away if I walk into a store wearing my ID, somebody is going to come up to me. So I know a lot of people like to thank Good Shepherd in any sort of way, a modest dollar way, a small dollar way, or a large dollar way, and we view it as it's a reflection of the role we've played in the community, and we honor everybody who we've touched over decades in many cases. So we're just honored to be able.
Could you just remind us what the timeline is again?
Oh yeah, great. Yeah, I didn't even give the timeline. So we officially broke ground right around New Year's. If you were to drive by today, you would see the trailers. You would see the land's been kind of leveled, and so so the project is underway. We are aiming to move in June of 23. So assuming we don't have crazy weather in the next month that would slow us down. I think we're beyond that. We would be on track to have the hospital finished in April, kind of go through the post-construction, punch list, staff training, orientation, and aim to relocate our patients who are in our hospital at the time of move to the new hospital. Right now we're saying the first week of June of 2023.
And we are hoping to, now as COVID cases go down, to start holding some more events and things as we, prepare and get ready to open this to enhance the excitement about our new hospital. So stay tuned to hear more about that with the community.
Yeah, we created, our marketing group created what they're calling Project Runway. And it's a whole series of events to bridge where we're at today to the new opening of the hospital. It's going to include things that you're going to see over the next, close to a year and a half of, for example, bringing in national inspirational speakers, someone who's really overcome some major disability or has a great story to tell. That's going to be part of Project Runway. We're looking at actually doing a takeover of one of the shops at the Promenade, one of the shops that are vacant, and having it as kind of for the next year or so, a kind of a pop-up Good Shepherd where we can host events or demonstrate technology or educate. So we're looking at that. We're looking at, I could go on and on. There's all kinds of really fun, interesting things that we're putting together called Project Runway, which will bridge where we're at today to the opening of June. Many things open to the public at large, bringing in national speakers, other events that, are kind of paying homage to former patients and everything in between. So much more to come on that.
Michael, you might have mentioned about this, but I'm curious about the existing hospital and if there's any major changes there that are going to happen, or how they'll kind of work together.
Yeah, so when we relocate the hospital to Center Valley, this hospital will then be vacated. By that time, so our plan is to reuse the building. So we're in the beginning phases of a planning initiative of what are the possible range of options that our building, after it's been renovated, because it is an old building and it does require a substantial amount of internal renovations. So the plan is to reuse it. We're in that planning phase right now to kind of evaluate what are the range of possible reuse purposes, ultimately settle on one. And then after we move out, kind of begin a renovation project, and, however long that may take is unknown right now. But the plan is to reuse the building. It's in a, great part of our campus. And so that's our intention. Okay, well, I think I probably used my time. I really appreciate everybody being here today and getting a chance to talk about what we're doing. We've got tremendous stuff going on. And as I said at the beginning, it's a very transformational event, not just for the rehab hospital, but really all of Good Shepherd. And we believe just really will continue to elevate the healthcare environment in the greater Lehigh Valley between what we do, what St. Luke's does, what Lehigh Valley does, what we all do together. We're going to elevate all of that for everybody that lives around here and beyond. So really appreciate the opportunity today.